If your child with sickle cell wets the bed, here's how to help them. I'm Dr. Lewis Thomas, a former doctor turned sickle cell coach, and I live with sickle cell myself. First, remember that it's not laziness or bad toilet training. Bedwetting in sickle cell happens because the kidneys can't concentrate urine properly, so children produce larger amounts of dilute urine overnight. And I made a previous video on this that you can watch for further explanation. So there are standard bedwetting tools that apply for any child. And briefly, these are reward systems for dry nights that can give encouragement and motivation, limiting fluids before bed, and enuresis alarms that help train the brain to wake up when the bladder is full. If you're not familiar with them, they're basically small sensors worn in the underwear that detect moisture and send an alarm to wake the child up to go and use the toilet. Now then, there's a few differences with sickle cell that you need to be aware of, particularly when it comes to medication. We have to be very careful with fluid restriction because staying hydrated is very important to avoid sickle cell crisis. So don't cut back too much water in the evening, and I would say to encourage the child to drink at least 2 liters of water during the day before 4 o'clock. The medication usually used in bedwetting is called desmopressin, and it reduces urine production overnight. It can be used in some cases, but it's essential that it's closely supervised by your pediatrician or hematologist due to the risks of sickle cell. So the safest first steps are adjusting fluid timing during the day, encouraging double voiding at night, and trying an enuresis alarm system. Most importantly, reassure your child that it's not their fault, it's a medical issue, and it will improve with age. Hope that helps. Follow me for more practical tips on managing sickle cell day to day.